Good evening. Once again, we are here in the marathon of 2013 of TV3. This year, we will talk about the metabolic syndrome, which is why we have a very special guest.
So we start by explaining that the metabolic syndrome is. The metabolic syndrome is a set of factors that determine the possibility of suffer a cardiovascular event such as a heart attack or a stroke. The metabolic syndrome can be observed by stress signs. It increases the risk factors. So we contact to Mrs. Yolanda Ortega Vila, general practice and member of the Catholic Association, Catalan Society of Family and Community Medicine, who is doing his PhD thesis about how the stress affecting metabolic syndrome.
Well, now we start with the questions. What is your specialty in the field of medicine?
The familiar and community medicine.
Where are you working?
In the basic area of Salou.
What do you do now?
I'm doing my thesis project.
Why did you decide to do it of this topic?
Because the metabolic syndrome is a highly prevalent syndrome and its control depends as well decrease cardiovascular disease that cause high mortality.
When did you start this thesis?
2 years.
Who will do the test?
For my patients who are over 14 years and have one or maximum two risk factors for metabolism.
Is somebody helping you in this thesis?
4 or 5 maids of the center. To explain better the project, we are going to make some questions. What process do you follow to obtain the results?
Of the patients that I have every day, I choose those with more than 40 years and only one or two factors of metabolic syndrome, and I give a questionnaire that they must to complete, where are tests of anxiety, depression, quality of life, and stressful life events. These are the four factors that we have considered that are stress. The fact that we have alterations in these four chimes imply that this person has stress. Then we relate to the clinical data of patient, such as cholesterol levels, LDL cholesterol, HDL cholesterol, blood pressure, cardiovascular risk, blood glucose, and triglycerides.
How many people have made this test?
In this moment I give more than 500 questionnaires, and the total of the project are 738.
Before starting this thesis, had you got any hypothesis?
The hypothesis is that people who has stress is going to undergo the metabolic symptom faster than who has no stress.
And now your hypothesis changed or you keep it?
To make the work harder, the questionnaire has to be administered now and the next year too. See if the stress or the clinical situation has changed. Right now, the first results don't achieve the hypothesis.
We have been documenting and we found that the 50% of sick leaves are caused by the stress. How do you think about
The stress is an indirect reason. Not all the displays can be labeled of stress. The stress transforms into a physical appearance.
Do you believe that the crisis is going to affect in the population of stress and we are going to undergo more cardiovascular disease?
If the hypothesis is right, we will have to try to improve the population's stress, because if we don't stop this, the population will be very unwell.
When your thesis will be finished, do you think that will be an advance to help to stop this sick leave?
I don't want to be so optimistic, because all this work is to prevent illnesses, but we are going to have knowledge about how the stress affects, and we will have to set measures of precaution.
We hope that your work may help society and we hope that to meet you again when you have finished this project.
Thank you for your cooperation and for giving us some of your time. Do you want to add one more comment? I will be glad of communicate to you the result if we can finish it. And thank you for help in the diffusion of this project. Here ends the special interview of the marathon of 2013.